Hi, welcome to the presentation on gastroenterology by Anna Kulikowski for pathophysiology at Goodwin University, Nursing 505, Spring 2022. Chief complaint and presentation, patient presents with abdominal discomfort, unable to clearly state how long this has occurred, but believes it's gotten worse in the past few days and voiced the pain being 9 out of 10. Review of symptoms and HPI. Max Goodwill, 59-year-old African-American male. Patient has noticed his clothes have been fitting more loosely, but has not made significant changes in diet. His height is 5'10", weight 245 with a BMI of 35.2, categorized as obese. Per documentation, last week's weight was 250. Diet consists of fast food, soda, energy drinks, but lately have not had much of an appetite. Patient has not had a bowel movement in 5 days and usually experiences 1 bowel movement a day with no history of irregular bowel habits. He denies feelings of nausea and vomiting, denies dysuria and urinary urgency. Patient has noted to be hunched down, guarding his abdomen. Leads a sedentary lifestyle. Patient voiced abdomen has always been giving him trouble, but recently has gotten worse. Patient is an active smoker, 2 packs per day for about the last 45 years, which equals a 90-year pack history. This began when he was about 14 years old. Patient also drinks about 5 to 6 nips a day of alcohol and has been doing this regularly since his wife died 2 years ago after having years of sobriety. Patient and family medical history. Patient is a type 2 diabetic, has hypertension, hyperlipidemia, GERD, hemorrhoids, angina, alcohol use, obesity, depression, and a history of appendix surgery that was removed at age 20. Family history, mother had died of breast cancer when she was 55, father passed away of stroke at 58, and was an alcoholic. No known allergies to be noted. Physical examination, these are significant findings. Vital signs, temperature of 99.5, blood pressure of 155/99, heart rate of 110, respiration 17, pulse ox of 94% on room air, and 9 out of 10 abdominal pain. Patient presents disheveled, smells of alcohol, unkept, clothes are dirty, and slight body odor. Skin is intact, warm to touch, diaphoretic. Bowel sounds are decreased in all 4 quadrants. Abdomen is firm, significantly distended, tenderness noted, tympanic bowel sounds in lower left quadrant. 9 out of 10 pain with palpation, possible mass felt on lower left quadrant. Rectal, genital, no stool for 5 days. Hemorrhoids present, yellow, clear urine with no odor. Neurological, drowsy, oriented to person, place, and event, but forgetful. And psychiatric, appropriate mood and affect. At times, words are slurred and speech is unclear, secondary to alcohol use. Some of the significant lab findings are hemoglobin is low, CRP is elevated, creatinine is elevated, lactate is slightly elevated. And white blood cells are elevated. Patient also had a positive stool for blood about 3 weeks ago that was not followed up on. Medications that were prescribed for the patient, men's 1 a day multivitamin, Celexa, omeprazole, aspirin, metformin, thiamine, folic acid, lisinopril, and atorvastatin. But patient voices he does not take these medications on a regular basis. So deep dive, what are the possible differential diagnoses for this patient? Discuss some common assessment findings for one of the differential diagnoses and risk factors. What additional testing and workup should we order to confirm the diagnoses? And discuss prevention and therapeutic measures for one of the selected differentials. I look forward to hearing your responses. Thanks.